Okay, we're gonna talk about food sensitivities and Hashimoto's. And food sensitivities are, I think they're becoming much more appreciated. I have patients coming in going, I want my food sensitivities done. I want my food sensitivities done. So years of a lot of us talking about food sensitivities is paying off because it's very important to an autoimmune thyroid case. In fact, I can't remember the last time I don't think I've ever had anybody come in here who didn't have any food sensitivities. And I rarely have somebody comes in here who has like less than 20 food sensitivities, believe it or not. So food sensitivities are really important. And here's the thing about Hashimoto's. It's a very complex condition. Clinical entity is just, I have pages. I have like 5 pages that I review on, and literally every Hashimoto's patient comes in and make sure that I've evaluated every single aspect of their case that could be flaring immune responses up against their thyroid. And one of them, of course, is the gut. And within the framework of the gut is food sensitivities, even though the gut is not where food sensitivities are actually made. So the bottom line is people come in and there's like 42 different triggers for autoimmune thyroid disease. If you've heard me say 39 in the past, that's because there's 3 more that have come to light since then. Okay, and so food sensitivities are a big one. Food sensitivities are a big one. They're a big one for Hashimoto's. They're a big one for setting off thyroids. They're a big one for those of you who are suffering from chronic fatigue. They're just huge, and they're way up there on the list of those 42. Because there's an order in which you have to attack these autoimmune cases. I get doing all the testing and doing the GI test and doing the adrenal stress test, and you can do the pathology, the pathogens, and you can do the chemical tests and all that type of stuff. And all those things can be valuable, okay? And I can get into the testing and when you need to take it and when you don't need to take it on a later video. But for now, then there's the food sensitivity testing. And for years, you've heard me say the food sensitivities testing out there is unreliable, and that's being generous. And then there's urine testing, and then there's hair testing, and there's all this type of stuff. And food sensitivity testing, I'll just leave it at this. This is not the whole subject, but it should be antibody testing. You should be testing IgG, and you should be testing IgA particularly, without getting into all that. But the IgA is really a big one to test, because any food that comes up as an IgA is really screwing you up because it's affecting the inside of your intestines where 75% of your immune system are. And if you have Hashimoto's, you don't want anything irritating 75% of your immune system. And food is something you're putting in there all day, 2, 3, 4, 6, for some of you, all the time. For some of you, lots of food, okay? So the potential there for exacerbation of your thyroid is huge. But beyond that, if many of you probably heard of leaky gut, many of you probably have heard of small intestinal bacterial overgrowth. Well, you're not getting those things if you don't have food sensitivities. It's not going to happen. So there's an order in which the system breaks down, and all of those things I just mentioned, the leaky gut, the small intestinal bacterial overgrowth, the food sensitivities, all of those flare immune responses that make cortisol go up in your adrenal glands, make your blood sugar go off like this. And all 3 of those things, or 4 or 5 of those things, what I already just said, are inflammatory. And then inflammation goes up, and then it flares, and it tells your immune system to attack your thyroid peroxidase antibodies or your thyroid or your actual tissue. And then boom, next thing you know, you're fatigued, your hair's falling out, and you're getting jittery and shaky, your heart's starting to palpitate and stuff like that. So it's a big deal. But here's a reason it's the really biggest deal. In the framework of attacking a case like this, if you don't get the gut better, I think it's fair to say I was in the original group of doctors that went like, holy cow, it's leaky gut. And then we found out it wasn't just leaky gut. And that leaky gut was a key player. It was an early key player. It was a good place to start. But to get the leaky gut under control, you had to start with the diet. You had to start with the diet. The diet is critical. There's a couple diets out there. Well, we use like 9 different diets, and we combine certain ones of them depending on the patient. That's how critical diet is, because the diet is the baseline for everything. If you have a diet that's you're eating foods every day that are causing you to have food reactions, that's screwing up the inside of your intestines. That's causing inflammation there. That's causing your blood sugar to go up and down. That's causing stress hormones to go up and down. That's causing inflammatory, what are called cytokines, to attack. It's caused, just the diet alone is causing a lot of things. Most of you who have autoimmune thyroid disease out there, okay, have Hashimoto's, you're going to tell me, or I'm going to ask you, and you're going to tell me, if I don't eat, I feel better. Yeah, because you probably have food sensitivities that are annihilating your intestines and causing inflammation, blood sugar fluctuation every day. And here's the problem. You eat the food on a Monday, but the way that a food sensitivity is caused, without getting into the weeds too much, is you have a broken down digestive system. Undigested food particles get into your intestines. The intestine doesn't like that, so that starts creating a response. The vast majority of them go into the toilet, but some of them get through that leaky gut that we've been talking about for 20 some years now. The leaky gut, okay? And then that gets in your bloodstream and goes to the liver. Believe it or not, the liver is where all those food sensitivities are formed. My point in telling you that is that takes time. It doesn't just go whoosh into your system and you go, oh my God, I don't feel so good. No, that could take up to 3 days for that to create a migraine, for that to set off an anxiety response, for that to cause your blood, your blood sugar well, no, it immediately sets off your blood sugar. So that was going to, but the point is, it takes 3 days before your liver tags it and goes, I don't know what the hell this thing is doing here. It's an undigested food particle. It doesn't belong here, it belongs in the toilet. And I'm not here to clear out your undigested food particles. So it tags it and creates an antibody, just like it would create for a bacteria or virus or something like that, to try to let you know the next time you eat it and you feel this reaction, don't eat it again. Except the reaction can be 2 or 3 days later. And so that becomes a real issue. Here's why all of that's really important. Go back to saying, the gut's a good place to start. A better place to start is the diet, because you're not getting the gut under control. If you have an autoimmune problem, the gut's a good place to start if you don't know what I'm telling you. Okay, and then you go on a fast, or maybe you go on the autoimmune paleo diet, and 25% you're going to do great, 30%, but frankly, 70% of you are going to have reactions to that diet. And I can get into that at another time as to why that is. But this is why food sensitivities are important, because you have to figure them out right away. And you have to have a diet that you're going to get on where you're not going to blow up, you're not going to have negative responses, and you calms everything down, but you're still eating while you're trying to figure everything else out, because the diet is the place to start. It is the place to start. But the problem is, as you read online, you think you got a SIBO issue, you take the diet, you do the SIBO diet, you feel good for 2 weeks, you get off the diet, it comes back. There's reasons for that can be handled, okay? So you need to figure out the right diet, and it usually starts with this oral tolerance problem. In other words, you're eating foods orally and your intestines aren't tolerating right because they haven't been broken down. You are going nowhere with any treatment for, I don't care if it's brain, I don't care if it's anxiety, I don't care if it's your blood sugar, I don't care what it is. You're eating a food every day that you put into your mouth, goes down through your system, puts a strain on your stomach, puts a strain on your gallbladder and your pancreas, inflames the inside of your intestines, causes inflammation go up, damages the inside of your intestines, in the meantime causes your blood sugar to go up, and then it causes your blood sugar to drop. You're not getting anywhere with anything you're doing. You're going to be the person who's come in here, and if you have gotten anywhere, it's because you're going to walk in here with 20 supplements going, well, I feel really pretty good because I'm taking this one for my stomach problem, and I'm taking this for my digestive enzymes, and I'm taking this for my leaky gut, and I'm taking this for the constipation that will come back if I don't stop taking this, and on and on and on and on and on. Truly. So the idea is you need to figure out your food sensitivities first. And believe me, this is an evolving understanding, so no test is perfect. But my favorite tests, I'll just go with my favorite tests, are the Cyrex test, the Vibrant test. This Everly Well test seems to be a decent one. I'm not sure about the Thrive test yet. Don't throw things at me, Thrive, okay. I think your test seems to be okay, but I just haven't seen enough of it to have my experience to say. But that one seems to be okay. But you're looking for a test that tests antibodies. Let me tell you something. If you have Hashimoto's and you do a test and it comes back with like 1 or 2 food sensitivities, that's wrong. I have never seen that. It's impossible. It's impossible. If you have a bad gut, you're broken down digestion, it's impossible for you to not have food sensitivity tests. So when people come in here and they show me that, well, I don't have to do a food sensitivity test because here's my test and I only got 3 food sensitivities. Then I do the test and they come back with like 30 food sensitivities. So it's an evolving understanding. That's the problem. Okay, so these tests are getting better and better, and they'll continue to get better and better. And more companies will just say, I got to do the antibody testing. But if you're doing hair testing or anything else like that, forget it. Don't do that. Sorry, I'm saying that with very definitiveness because I think I figured out the other day we've probably seen over 5,000 patients since we started doing functional medicine. And so we've got a pretty good clinical ability to observe these things and see what works and what doesn't work. And so I'm trying to give you ability to observe these things and see what works and what doesn't work. And so I'm trying to give you the best practical clinical data that a doctor should depend on if he wants to get or she wants to get the right data so that they can start to execute a case properly. So that's kind of the nitty gritty on food sensitivity tests. And trust me, we could go on for hours on food sensitivity tests. It's the nuances and how accurate are they, and should I remove all the foods, and should I just remove? That's a whole nother thing. But the first thing you got to do is get a good test and get good raw data, and then find somebody who knows how to translate that test for you, because the test translation is okay that they give you, but it's okay. It's not. They cannot possibly give you a test translation for you. Why? Because everybody's stress responses, which will change your food sensitivities, is different. Everybody's microbiome is different. Everybody's immune system has different what's called plasticity. In other words, some are more reactive than others, some are more resistant to foods than others, and so on and so forth. And they cannot take that into account. It's impossible. So that's where you need somebody to in your world to be able to. Sometimes you'll find a company that will do it for you. But until that person has your history and they really have a good idea of you, it's hard to evaluate the food sensitivities to that degree. And I'd say that, Sherry, I'm not trying to get you some business or anything. I'm just trying to tell you, if you go and you get all these food sensitivities and then you're confused, you do exactly what it says and you still have problems. It's because there are other things going on, or some of the nuances of that particular test have not been explained to you, or you use the interpretation rules that they said, and they weren't enough for you to really interpret it right. So I mean, I know that's not like a great thing to tell you, but I'm just trying to tell you what I run into every day here at the office and give you that data so you know where you're at. I'm not discouraging you from getting them. Get them, see what they say, take out the food sensitivity, see how you feel. That's first step. First step. If you have autoimmune thyroid disease, if you have any autoimmune disease, first step of many, but nevertheless, the first step. Okay? So that's what I know about food sensitivities to date. Okay.